Introduction. Hello, and welcome to Nurse Mastery Academy. In today's lesson, we are focusing on one of the most essential topics in nursing school, and on the NCLEX, sodium imbalances, hyponatremia, and hypernatremia. Sodium plays a major role in fluid balance and brain function. So when sodium levels go too low or too high, the brain is the first organ affected. By the end of this lesson, you will understand the causes, symptoms, treatments, and nursing priorities. You will also practice with 10 NCLEX-style questions and rationales. Let's begin. What sodium does airwings? Sodium helps regulate fluid balance, nerve transmission, and brain activity. The key idea to remember is sodium controls the brain. Any sodium imbalance can lead to neurological changes, so always assess mental status first. Hyponatremia. Hyponatremia occurs when sodium levels drop below 135. The most important concept is low sodium causes brain swelling. Common causes include excessive water intake, SIADH, heart failure, vomiting, diarrhea, and diuretics. Symptoms include confusion, headache, nausea, weakness, and in severe cases, seizures. Your number one priority is neurological assessment. Treatment depends on severity. Mild cases require fluid restriction. SIADH requires strict fluid restriction and sometimes diuretics. Severe hyponatremia may require hypertonic saline, such as 3% normal saline, given slowly. Never correct sodium too quickly. Rapid correction can cause a serious condition called central pontine myelinolysis. Hypernatremia. Hypernatremia occurs when sodium levels rise above 145. In this condition, the brain becomes dehydrated and shrinks. Common causes include dehydration, diabetes, insipidus, kidney failure, fever, sweating, and burns. Symptoms include intense thirst, dry mucous membranes, irritability, restlessness, confusion, and seizures. Treatment focuses on gradually restoring fluids. This may include oral water, hypotonic IV fluids, such as 0.45% saline or D5W, and correcting the underlying cause. Sodium must always be corrected slowly to prevent dangerous brain swelling. NCLEX memory tricks. Here are helpful memory tips for exams. Sodium equals neuro. Always assess the brain first. Low sodium causes swelling. High sodium causes shrinking. SIADH leads to hyponatremia. Diabetes insipidus leads to hypernatremia. Hypertonic saline treats severe hyponatremia. Hypotonic fluids treat hypernatremia. And your number one priority for both conditions is level of consciousness. NCLEX questions. Let's review 10 NCLEX-style questions. Question 1. A patient with sodium of 120 is confused and lethargic. What is the priority intervention? A. Oral fluids. B. Hypertonic saline, 3% C, diuretics, D. Ambulation correct. Answer B. Severe hyponatremia with neurological symptoms requires hypertonic saline. Question 2. Which symptom is most concerning in hyponatremia? A. Fatigue. B. Muscle cramps. C. Confusion. D. Thirst. Correct answer C. Confusion indicates possible cerebral edema. Question 3. A patient with hypernatremia is extremely thirsty. What does this indicate? A. Kidney damage. B. A normal protective mechanism. C. Fluid overload. D. Hypokalemia. Correct answer B. Question 4. Which patient is most at risk for hypernatremia? A heart failure patient. B. A patient with SIADHC. A patient with diabetes insipidus. D. A COPD patient. Correct answer C. Question 5. Which order should be questioned for a patient with sodium of 150? A. 0.45% saline. B. D5WC oral water. D. 0.9% normal saline. Correct answer D. Normal saline contains sodium and will worsen hypernatremia. Question 6. A patient with SIADH will require A. Increased fluids, B. Fluid restriction, C. Potassium supplements, D. Protein restriction. Correct answer, B. Question 7. What must be monitored when giving 3% saline? A. Dry skin, B. Pulmonary edema, C. Bradycardia, D. Constipation. Correct answer, B. Question 8. Why must sodium be corrected slowly? A. To prevent heart damage, B. To prevent brain swelling, C. To improve kidney function, D. To prevent dehydration. Correct answer, B. Question 9. What is the appropriate treatment for a dehydrated patient with sodium of 149? A. Sodium tablets, B. Hypotonic IV fluids, C. Fluid restriction, D. Diuretics. Correct answer, B. Question 10. What is the priority assessment for sodium disorders? A. Urinary output, B. Neurological status, C. Skin turgor, D. Bowel sounds. Correct answer, B. Conclusion. This concludes our review of sodium. Imbalances, hyponatremia and hypernatremia. Understanding sodium's effects on the brain, recognizing critical symptoms, and knowing the correct interventions are essential skills for both nursing school and the NCLEX exam.